Hi, this is Dr. Lifton from Brain Splained. I want to talk about why people get numbness and tingling and dysesthesias. It's curious to people. They kind of don't get it. Dysesthesia is what they get. Numbness and tingling is one of them. There are many of them, and it is a sensation that you are not supposed to have, that you're not expecting. And very often it's odd. It's kind of not really a normal feeling. And other than pins and needles, it can be squeezing or freezing. It can be burning. It can be a sensation of water, a sensation that you're walking on marbles. It can be bugs crawling on you, knives stabbing you, electric jolts of pain, almost anything. All kinds of sensory experiences can occur. And they don't correlate with an experience that ought to make them happen. They don't correlate with some physical experience that should be creating that. And so your feet are burning, but they shouldn't be. And those are called dysesthesias, and they're abnormal sensory experiences. And the way they work is that in irregular circumstances, in order to experience sensation, a nerve will send a signal to a place. That nerve is not acting in an isolated fashion. It has input to make it want to send this signal. And it's not the only one sending the signal. There are many, many fibers, many nerves that are thousands that are saying, hey, there's something touching my foot, there's pressure. The pressure sensation is happening. In order for a nerve to decide that it wants to send that signal, there are many inputs that are excitatory that say, yes, send the signal. There's pressure here for sure. And there are many inhibitory signals also occurring simultaneously saying, yeah, there's no pressure here. Ignore that nonsense. And some of the signals will be more important than others depending on how they're located. And then even after that signal gets sent, there's no guarantee that you find out about it, okay? So when that nerve, let's say it's a foot nerve, when that nerve gets to the spinal cord, it then has to attach to another nerve who sends it from the bottom of the spinal cord up to the first part of brain. And that nerve doesn't make direct contact. It goes through these interneurons, which are connecting nerves. And during that process of trying to get the signal to come up the spinal cord, there's another series of, I always call nerves people by accident. There's another series of decisions that are made by summating signals that are both inhibitory and excitatory that say yes and signals that say no, and then either the signal dies there or it goes up further to the top of the spinal cord, and then it goes into a place called the thalamus, which is brain but not really brain like what you would normally think of it. You're not aware of what's going on in thalamus. And then that does the same process, and then another series of nerve cells will send it from there to your what's called cortex, which is what you think of as brain, where you actually feel it. So when you feel something, what has happened is thousands of inhibition signals have been overrun by many more excitatory signals that say yes, you ought to do it. And the way that essentially is functioning is with what we in electrical terms call a no-go signal. And when you experience things you're not supposed to experience, you can do that because you've lost an adequate amount of inhibitory signaling. So you've lost the no-go signal, and now the go signals take over. And so you get go signals that are not properly being modulated and that don't belong there. When you're very busy with your brain and with your activities, your brain turns off a lot of signals coming up from your spinal cord. It has downward inhibitory signaling pressure. It says, don't give me any nonsense right now. I have to work on this video game. And the painful stimuli will be suppressed because of that modulation. So that's why when you're busy at work, you're doing better. And then at night, when you go lay down, your symptoms of neuropathy, dysesthesias, come up. And it's very, very common, almost diagnostic, that people with neuropathy and dysesthesias will complain that it's worse at night. In many cases, when a person has a dysesthesia, which is this abnormal sensory signaling, they get told, oh, you have neuropathy. And they think that neuropathy and dysesthesias are synonymous. And I know that because the language that comes into my office, that patients talk that way. It annoys me. because they don't necessarily have that diagnosis. And the way it works is that you can get a dysesthesia by a disruption in the pathway where you lose inhibitory responses because of any of those signaling areas being disrupted. So you can have a nerve problem and it can give you dysesthesias. You can have a spinal cord problem and it can give you dysesthesias, and you can have a brain problem and it can give you dysesthesias. So just because you have dysesthesias doesn't mean we know for sure that you have neuropathy, even though the likelihood is overwhelming. So, 99% of the time if somebody's got dysesthesias, it's going to be because of neuropathy, especially when it's distributed appropriately. So it starts off, very distally. Distally is far away, so it starts off in your toes and then works its way up your feet. But if you have dysesthesias and they're not in that distribution, then in all likelihood it's not that. For example, with radiculopathy, which is a pinched nerve in your spine, your dysesthesias, when they come on, are in a different pattern. Sciatica, which is a very sharp, intense, burning pain that shoots from your buttocks down to the back of your leg and into your toes sometimes, that dysesthesia is not from neuropathy. That's from a pinched nerve, most commonly at S1, but also could be at the sciatic nerve in a couple of locations. So that's why it happens. I hope that's brain-splained, and I'll see you on Friday.